Welcome back, America, to your COVID Data Science channel. Today is Tuesday, August the 17th, 2020, and it is time for your daily COVID-19 analysis. Before we get started, be sure to click on that subscribe button, click on the like button, and most important of all, click on the share button. Share this video with your friends and your family today on YouTube and Twitch. On YouTube, Twitter, and you can also cut and paste the link to this video into an email and share it with your friends and family that way, okay? Now, one of the curious things about COVID-19 is the way the numbers are being counted. Normally for say a disease like cancer or heart disease or something like that, right? The deaths are recorded 1 year at a time. So every January 1st, the numbers for cancer are set back to zero. That way, you also know how many cases you have. Okay, you always know how many cases you have. Uh, how many deaths you have for each individual year. But for some reason, COVID-19 is being tracked from day one, from the date of the first case and the date from the first death. Okay, so keep that in mind. So this number is roughly 18 months worth of data. Okay, 18 months worth of data. So for the previous 18 months, we had 36 million. We had what? 36.8 million cases, 622,000 deaths. And this is a number with a 14-day average for January. So how is this number reset to zero on COVID-19? And you can see we are seeing a spike up in cases. Okay, but to keep in mind is, though, as the COVID-19 vaccine continues to be rolled out, the COVID-19 vaccine will not keep you from getting COVID-19. So these numbers could very easily continue to climb even among people who've been vaccinated like myself. Keep that in mind. The purpose of the vaccine is not to keep you from getting COVID-19. It's not even to keep you from dying from COVID-19. The purpose of the vaccine is to reduce your chances of dying. So that means you can certainly still get COVID-19 if you're vaccinated. You can even possibly still die from COVID-19 even if you've been vaccinated. All right, very important number there. So these are cases. Look at deaths for 2021. We don't want to lose track of this decline here. Okay. There was a spike here, but the average is still, but the average daily numbers is for the 7-day period ending here is still about 500 to 600 cases or deaths right there. Okay. So we're comparing the 2020 to 21st. Uh, all we saw was a steady increase in cases in 2020, but we had a long decline in cases in 2021 down to July. But again, these numbers are starting to climb. Uh, Now let's take a look at deaths. All we saw was an increase in deaths in 2020. But look at this long declining pattern in deaths. It's almost a mirror image. The pattern is the trend is the exact opposite for deaths in the U.S. Right, COVID-19 deaths in the U.S. A steady declining pattern. Okay. Now here's our daily cases. You can see. Well, so up here we have 290,000 deaths. But all of a sudden it drops all the way back down here to 42,000. How can we go in one day go from here down to here? I just don't buy it. I just don't buy it. Okay. Then it's back up on the 16th up to 210,000 deaths. But the deaths are continuing to look pretty good. We are seeing a slight increase here, but you can see again, this is why you had this on August 10th or August the 13th. We reported 1,889 deaths, but on August Okay, so what you see here on August 16th, that number dropped back down to 686 deaths. So why this volatility here, okay? Uh, Again, this is why we use moving averages to cut through the volatility, the daily volatility. So on August the 9th, August the 9th, we were averaging, with a 7-day period ending August 9th, we were averaging uh, 610 deaths, 610 deaths per day. Okay? You can see here a 4 or 5 or 6 week increase in cases. Again, remember, the question is how many of these people with cases have actually got the vaccine? See, there's some numbers that I don't think we're getting here. We're not getting numbers on the on which cases and which deaths were with people who were vaccinated. Do we know how many people in hospital who admitted to the hospital were vaccinated? But I'll remind you also of something that Washington University here in the U.S. says. Washington University says about COVID-19 that the single best measure of a pandemic is daily deaths, not cases and not hospital beds. So don't allow yourself to be misled by the liberal media and the president's office, and the office of the president. Okay. Now look at these declining. Look at this long decline in U.S. deaths. But you can also see we've had a 4 week increase in deaths up to about maybe 4,000 for last week. But this week it could decline back down, so we need to keep an eye on that. Now, if you look at monthly cases, you can see that this is still 1, 2, 3, 4, 5, 6, 7, 8 months in a row when our monthly cases have been below this high back over here. Now we are seeing a 2 month increase here, but the numbers are still well below these highs over here. And what's this? 1, 2, 3, 4, 5, 6 months so far. We've had a 6 month decline in COVID-19 deaths in the U.S. Now it does appear that this will probably inch back up with another 13 days to go. This could very easily pass this number here and wind up as high as here. But even if it comes up to here, which is 12,500 deaths for the month, that's still considerably down from these numbers over here. It's down from all these numbers over to here. So that's still pretty doggone good numbers, okay? Now this gives us a rough estimate of the number of cases per 100,000 people. So right now, we're about 30 to 40, on average, 30 to 40, out of 100,000 people, 30 to 40 have COVID-19 right now. But what about deaths? Well, this line here is 1/2 of a person. So that means right now we're averaging about 1/2 a person. Right now, on average, about 1/2 of a person out of 100,000 is dying from COVID-19. This is the cumulative total numbers to date. What we're looking for is a flattening of the curve. You can see cases are increasing. And again, this number here may never flatten out, right? Because again, the COVID-19 vaccine doesn't keep you from getting COVID-19. Deaths, deaths are flattening a little more, but we still really want to see this number level off even more there. Okay. So that does conclude your report for the U.S. for today. Thanks for stopping by. Hey, don't forget to click on that subscribe button. Don't forget to click on the share button. And don't forget to also share the video on Facebook and Twitter today. And don't forget to subscribe also. Thank you so much for your time, America. We'll catch you tomorrow with an updated report.